Thanks for staying with us. So, months after lockdown, Nigeria now feel it's safe. A lot of Nigerians feel it's safe to let their guards down. Hands are no longer washed often. Face masks are almost forgotten. Mass gatherings are no longer a problem. Parties, weddings, and even protests are back. However, the World Health Organization has warned us about the second wave of COVID-19. Now, you can join the conversation at 090-241-63440. You can also tweet to us at TVC Connect. Please hashtag YobiTVC so we can read your tweets. Okay, many of you know I'm laughing. I'm laughing because I'm guilty as charged. Because over the weekend, I did go to a party and I posted on Instagram. So everybody said, there's no face mask, you need social distancing. Yes, we are all Nigerians. And the truth is that we've all gone to parties. Because I posted my own doesn't mean that I'm the only one that is the culprit. Everybody is. Because we don't see you in the various cupboard. But we are all Nigerians. We've all gone to parties. We've all gone out without using our face mask. We've all refused to do social distancing. We've seen everybody at parties.
Don't say all.
We're hugging now.
Most of us. Don't say all.
Okay,
because me, I'm very, very particular about it.
Right.
And, sometimes, you're sitting down, you're eating or you're drinking, you can't wear your face mask.
Right.
So I take it off. And people might get offended.
Right.
Because when they come towards me, I put it on.
Yeah.
If you come towards me, I put on my face mask. I'm protecting you and I'm protecting myself.
Right.
As far as I'm concerned. So please, if you see me and I put on my face mask, it's not because I want to offend you. It's because it is supposed... This thing is real. I'll give you an example. My cousin just recovered from COVID, and I never used to see that my cousin with a mask. I used to, where is your mask? He will go and he has underlying health issues, so he was very lucky. And it's not cousin this time, because it's my first cousin.
Wow.
And during celebration, we had it was a virtual celebration, so I wore my mask all the time. But even with the virtual celebration, you have people around. And my cousin was lying on the couch. Bros, everything is all right. Everything is all right. But because he has underlying health issues, everybody thought, this is underlying health issues. On the Sunday, another cousin took him to the hospital and he was positive. Now imagine and I sat beside him. If I hadn't been wearing my mask,
you would have caught it.
Myself, I'll be in hospital now. That's one.
So Waike, thank you for taking us there, because that's the reality. I mean, we can laugh about it, but the truth is that COVID is still here with us, and all of us must retrace our steps. Even myself, because I wanted to say it clearly, because I know the trolls are waiting for me. They're waiting for me to finish this show and now come under me. And I'm just admitting it to you that yes, we have all fallen short of the glory of COVID-19.
Even when I'm talking, I mean, you can be with someone, you won't take a picture, they say, oh, no, please remove your mask. So I will remove my mask out of politeness.
Right.
But when I get home, I'm always, maybe this is the day I've caught it. I don't know.
Right.
And it's the truth.
Be careful. Yes.
On a lighter note, though, during the protest, the way the crowd, people, I was thinking by now we would have had several people fall ill or several people died and all of that. So I've just come to a realization that this COVID now is not like malaria. I don't think if they test any of us, say that we all have it. We must have had it 1, 2, 3 times and we don't even know, and it has gone. I said on a lighter note. So because the way people move around now without precautions, we should have more deaths, but we are not having. We are not having it. So it could be something in our genes that is actually saving us, but I would still ask that we take the proper precautions.
This is where I want to disagree with you. I will agree with you on one. I believe that maybe because we've had malaria, a lot of us have built immunity towards malaria. The COVID-19 is not hitting us the way it is hitting the Western world. We have vitamin D, natural sunlight, so it's not. But don't say it is not hitting us, because think about it. In the last 2-3 weeks, we've heard about not 1 death, not 2 deaths, not 3.
And they said strange illness.
Of several deaths.
Me, I've not heard of any death. Nobody
around me has died.
Your ears are not open. Your ears are not open. If your ears were open, I'm telling you, a friend of mine, his brother died. He said when they took him to the morgue, they were just bringing in dead bodies. There was queue.
YK, in this Nigeria.
We've heard that.
That haven't finished.
Okay. I don't know about that one, YK.
I said,
how many did you that hearing all this story? We've not heard this kind of
thing. Ears are to the ground. You are blinding your ears by putting content over your ears. I don't even understand.
In Jesus' name. My 18 debate is not evil. Please.
I heard another one yesterday that died. I remember seeing this person. He came to me, this was maybe about 2-3 months ago, and he was not wearing a mask. And as soon as he came to me, I just did like this. And he was talking. Now, I hear now. I don't know what killed him. It could be.
It could be.
My point is, my cousin said that while he was in hospital, they gave him a blood thinner. They gave him blood thinner because they said that the people are having blood clots that is killing them through this, from this COVID. One line. That the thing, so they gave him that blood thinner. So when you are just hearing, this one just died heart attack.
Strange illness somewhere.
20-something-year-old, he was just sitting at home, he just collapsed, boom. Nadeski. Think about it. Now put your ears on, remove those earplugs you put inside your ear.
Have earplugs.
So that you can hear well.
Okay, so let's get
Thank you, ma. Thank you.
I must take you to the serious.
Yes, thank you.
And because me, I'm
and
what you call risk, high risk.
Yes,
age bracket. You're in the high risk level. But I would also, on a serious note, I mean, yes, listen. We've all, as we said, we agreed that we've all kind of let our guards down. But the truth is that we need to get very precautious going forward. We need to begin to wear our face masks and try to observe social distancing. When you enter the malls, they don't allow you to enter without the mask. The school, the kids' school, they have to enter your mask. So I think let us go back. Let us retrace our steps. And those of us that like to go to parties, go to parties. Nobody says you should go to party, but please observe social distancing. I will start going. No, I won't dance again. I will just stay in my seat. Like Waiki, I'll remove going to eat. And I'm serious. Listen, we have to be realistic because we don't want what's happening in Europe to happen to Nigeria. What's happening in the US, where they say that about 100,000 people have gotten COVID in one day. I mean, these are figures that are startling.
That's the US.
So we have to ensure that we don't want that in Nigeria, and we have to protect
also
ourselves.
Fear kills faster than the COVID-19. So why we are not seeing so much death is because people are a bit more relaxed. They are trying what they can do, but there's no fear of, if I talk to you, if I don't stay this parameters away from you, this meters away from you, and all of that. So let's avoid the fear. That's one. Let's also try as much as possible to eat healthy. I know a lot of us came up with the habit of taking our ginger, a lemon. Those are drinking, are drinking. We have all of these natural herbs. We're still drinking. I have lemon and ginger every day. And it could be what is saving us. You can't say. Let's just say.
I'm still drinking my agbo. I'm still drinking my lemon and ginger. I take my vitamin C, vitamin D, omega, everything. I'm taking everything.
Overdose.
In fact, I'm a walking pharmacy, as you are saying me like this.
So I don't want to die.
No, you can't die now.
Let me see my grandchildren grow up small.
Amen.
So that is why I take all the. In fact, everybody in the house, they are drinking agbo with me now. My brother went out on protest. He didn't wear his mask. Everybody from abroad was calling him. You want to wear your mask? It's true. And this is somebody who hasn't been out for 7 months.
Wow.
He's not stepped out of the house. The day he now stepped out, he stepped out into
protest.
I told him, I said, the Coro will say, fresh body, see,
fresh
body. Because all of us, it has probably been touching all of us.
One way or the other.
They are fortifying themselves.
Today is Tuesday. Why?
Listen, we've made this, we've laughed over this. Let's bring it back to the seriousness that it deserves. Yes, we are laughing over it because we are Nigerians. We like to, be jovial about everything.
Life is hard here.
Yes, but the truth is that please keep safe. We have to wrap up on this. Bisi, we're going to say something.
Yes, I want to say that let's also advise people around us. A lot of people still argue that there is no COVID-19, probably because they haven't seen deaths. Let's tell them that it's real. You should take all the precautions. Make sure you have sanitizers in your bag and just do what you need to do.
And keep your ears on the ground, like Waiki said. Me, my own ears are not on the ground.
Remove the cutting board.
I would try to. Maybe I don't know, because by God's grace and mercy, nobody has died around me. By God's grace and mercy, not because we are better, but I've not heard of anybody by God's grace, honestly.
Okay.
But I'll keep my ears on the ground and try very hard.
Keep your ears on the ground. You hear that maybe this person down the road died of it. No, it's strange illness. It's strange illness.
That's what they call it now.
It's heart attack. Everybody's heart attack that is killing everybody now.
So it's no more COVID.
It's no more COVID. It's heart attack.
Like, please decide, is it COVID or is it not?
I'm saying, because my partner is always fighting with me. When I just hear somebody, I say, it's COVID. So what is wrong with you? Everybody, I say,
everybody's COVID.
My cousin now confirmed that the blood thinner is giving everybody heart attack. I said,
You have linked it well.
I now went to my partner and said, you hear what they said? Now it's COVID, though.
Anyway, we have to wrap up. I think we've gotten the message. We've gotten the message. Please, let's continue to stay safe. Stay safe. Let's go on a break. We'll be right back. Now, moving on to the next segment, diabetes is our focus, is one of the major health development challenges in our society. Report has it that there are currently 366 million people living with diabetes, and this figure is set to rise to over 550 million by 2030. Joining us on the show is an endocrinologist and president, Endocrine and Metabolic Society of Nigeria, Professor Fasamadi. Welcome to the show.
Thank you.
Good to have you. You can call us on 090-241-63440. You can also tweet to us at TVC Connect. Please hashtag your TVC so we can read your tweets. I know we have loads of tweets on COVID-19, so I'd like us to take a few of those before we now even hear your thoughts on COVID, before we now talk about the diabetes. Yes, Waiki, go ahead, please.
Okay. Bilikis Fagami says, I applaud you, ma. This might sound funny as you say you are a working pharmacy, but it's the responsible thing to do, ma. Prevention is better than cure. Paulinus, I sent him the number. Good morning, Murayo and your team. Sometimes I feel like contributing on your program. Don't have the mobile contact. Please, I want to contribute to the COVID-19 issue, and it's very important. So I sent him the number. I've been hearing left and right center, Owambe has resumed in Nigeria big time. There is no COVID. People have thrown caution to the wind, but Corona is still very much out there, and prevention must be adhered to. Do you have any?
Let me build. Okay,
Just Nancy says, Nigeria, our country. Sickness is like a fashion in our country. It's only taken serious when it's new. And
okay, let me build on that. Let me build on that.
Just one more. Sorry. Murayo, Nigerians are thick-skinned, and they need special approach, as many die without diagnosis. The experience of one who survived it is enough to make you dress like you are spacebound. Caution, please. It has neither color nor smell.
Thank you very much. So before this segment, we had discussed COVID-19, and many of us have thrown caution to the wind, as the Twitter said. Many of us attend parties. We don't even use face masks anymore. I mean, I am #1 culprit. Let me just say that. But I am here because we want to retrace our steps and want to do it better going forward. Because if we show the example, many people will follow. So tell us exactly your own view as a medical doctor. Have you been engaged with COVID patients recently? And what's the situation in your own view? Is it really subsiding as we think, or is still really much out there?
Well, thank you for having me on your program. COVID-19 is still very, very much with us. Even the NCDC figures you will see every day, they still range from 100 to 200. And this is on the backdrop of the fact that the number of people that should be tested are very, very few. There are some countries where as many as 100,000, 500,000 people are tested on a daily basis. We sometimes don't get that done in months. So it is a very high prevalent condition, but unfortunately many people don't believe, many people are not tested, and even those who test positive, they hide their diagnosis. I've been invited to funerals of people who died from COVID-19, and nobody in such funeral even knew that the person who was being buried had COVID-19.
Yes.
I've been to social engagements where everybody in the hall was without a mask, and we were sitting like sardines, and I was the only one wearing a mask, and I felt very out of place when everybody was staring and saying, what's wrong with this man wearing a mask here? And even just last week, I went to my town in Ekiti State, and when I reached there, everybody was saying, Ebokini Idano, remove this thing, it's not in this place. So that is the attitude. So the problem is people don't believe.
I don't know if people don't believe. I think we generally believe, but we just feel as if we are immune to it. We can't die because we hear all these figures abroad, people are dropping like flies. Here, we don't seem to be dropping like flies. We seem to be beating it with our goals and our working pharmacy lifestyle. And I mean, if I heard Waiki said she's a working pharmacy, she takes vitamin B, E, F, A to Z. She's taking the vitamin. It's not even healthy. So in your view, is it that we are somehow common immune to it, do you think?
We are not immune to it. I think the level of people that are affected in Africa is much less than in other countries. But there is no special immunity that we do have. People feel that the reason why we might show some relative resistance to it could be due to things like vaccinations with BCG, which many people have, or recurrent viral infections and bacterial infections that people have in the community in most of the developing countries and the third world, that somehow makes us a little bit more resistant to the condition. But those who have had it, there are people of all colors, of all tribes, of all ages. of all sectors, because some people feel it's an ailment of the rich because they hear a governor tested positive, a president tested positive, a musician tested positive, so they feel it is a disease of the elite.
Okay, we're going to quick break. When we come back, we'll continue this conversation with our guests. Stay with us, we'll be right back. Thanks for staying with us. So we're still talking about diabetes now. Bisi had the questions. Go ahead.
Yes, sir. So anytime I hear the word diabetes, what comes to mind is probably the disease of a very fat person. And some of us really do not understand what diabetes is. So can you tell us what it is and some of the types so that we have a better understanding of what diabetes is?
Thank you. So diabetes is a condition that is, it's something that is quite common in the Western world. We have about 470 million people suffering from it right now. And when you say a person has diabetes, what you're saying is that the person has a blood sugar that is persistently higher than normal. Every single person has sugar circulating in his blood, whether or not you take sugar, because sugar is like our petrol, like our fuel. But with diabetes, the numbers or the figure of the blood sugar is persistently elevated. It is partly true that diabetes is commoner in people who are obese or people who are overweight. But there are some people that have diabetes who are even skinny because there are different types of diabetes. The type 2 diabetes is the one that you have typically described, one that occurs in an overweight or an obese person, usually in the middle age. That is the predominant amount of people that have diabetes type 2. Type 2. But the type 1 diabetes occurs in younger people, sometimes children as young as 1 year, as young as 2 years. Wow. Those ones may not be obese. In fact, most of those ones are skinny. And many people will attribute other ailments to this type of diabetes before either the patient is lucky to have the diagnosis or the patient dies without people being aware.
So once diagnosis is made, people are always scared of how expensive it is to maintain. Do you think, is it now affordable? Because back then it used to be so expensive to manage diabetes. In your view, is this something that is affordable now in Nigeria?
Well, when you look at the minimum wage of Nigeria and then the typical expenditure of a person with diabetes, you know that it is not affordable. A person that has type 2 diabetes, for instance, most of them are on 2 or 3 different types of tablets. Some of them are on injections. And then they have to check their blood sugars on a regular basis, almost every day. Some of them also have to test their urine. So you find most patients are spending between 10,000 to 30,000 for their medications.
Wow. Monthly?
Monthly, because diabetes doesn't also come alone. Many people that have diabetes also have hypertension.
Wow.
They also have high cholesterol values. So you are taking medications for the diabetes, for the hypertension, for the cholesterol. So an average patient in Nigeria with type 2 diabetes will be on at least 5 medications. So that takes them about 10 to 20,000 naira. So you can imagine if that person is a minimum wage earner of 30,000, it means he can't even afford it. So what many of them now do is they try to either reduce the dosage of the injection they are taking or reduce the number of tablets they should take, and that leads to shortened lifespan.
Is it true that once you've been diagnosed with diabetes, you have to stop sugar completely? Anything, or like even rice has sugar, so is that true?
It is not true. The person with diabetes can eat almost anything. What we do tell them is that they should take little or no refined sugars. And you'll find refined sugars inside soft drinks, inside table sugar, inside honey. So those we contain, yes, cake, pastries. So we just tell them to avoid those. A person with diabetes can eat eba, can eat amala, can eat tuwo,
rice, uncle,
can eat rice, but preferably the local rice, like ofada rice, because it is not so refined. A person with diabetes shouldn't take over-refined food.
Let me take this call from Badagry. Michael, are you there? Thanks for calling.
Yeah.
You're live. You're live, Michael. Go ahead, please.
Yeah, even people are talking about the topic you discussed before, the diabetes.
Yes. It's your view. Let it count. Go ahead.
People are doing nonchalant attitude. do we have COVID-19 in Nigeria? Do our doctors know what is COVID-19? Our medical practitioners. I don't think they know the meaning of COVID-19. They only had maybe the Western world that such sickness is existing, and they are just promoting it over here in Nigeria. What I expected from them is to go and do research and know how come about that sickness. If it is existing at all in Africa, I'm not sure it's existing even in Nigeria. And they should make a way and look for how to get their own drugs, if at all is existing. And they are here just promoting it, talking about masks. Who even told you that the mask can protect you from contacting that COVID-19? Is the mask, does it have any chemical applied to it or anything that will scare the sickness away from contacting it?
Thank you very much. Michael, you live in Badagry. Thank you very much for your view. So Michael is a Nigerian that doesn't believe in COVID-19. I mean, we obviously need to do a different show for Michael because we need to re-educate Nigerians. The truth is that, I guess you're right. There are people that don't believe it exists. So we need a new show for that. But let's go back to the issue of diabetes. Prevention. I mean, people tell us you can actually get it from your parents or it's passed from generation to generation. How true is that? And can you prevent yourself from getting it? Can you protect yourself from getting diabetes?
Well, diabetes has two major predisposing factors. One of them is the one we call environmental, meaning that things that we can do or things that we do wrongly. And then the other one is the hereditary aspect. If a person has one or two parents with diabetes, he or she has a higher risk of diabetes. But the diabetes won't occur except you do something else, and those are the environmental aspects or the acquired aspects. For instance, a person who knows both of his parents have diabetes and every day decides to take 4 bottles of soft drink and 2 bottles of beer, that person is really heading for it and will certainly have it. But a person who has both parents with diabetes, and even before his own diagnosis of diabetes, he has started to exercise. He has kept his or her weight within the prescribed range, watches what he eats, lives a healthy lifestyle, doesn't smoke, doesn't take alcohol. And then every day with his step counter, he's doing like 10,000 steps daily. That type of person might not develop diabetes even if all his siblings around him develop diabetes. Yes.
Yeah, before your alcohol question.
Why you just what I have?
Before that alcohol question. So I know that some of us are not in a habit of regular checkups. So, and sometimes we don't know we have something till after it has exploded. So what are some of the symptoms that people may see that would likely tell them this is what you're about to have so that you can start preventing or treating?
Well, diabetes is one of the non-communicable disorders, and many of them don't have symptoms. For instance, hypertension doesn't have symptoms except it's complicated. Diabetes, more than half of the patients don't have any symptom. But those who have symptoms, they should consider themselves lucky because something makes them now have to go to hospital. A person who typically has the classical symptoms of diabetes will be drinking excessive quantities of water, will be passing excessive quantity of urine, will be eating like a horse, and yet will still be losing weight, might have generalized itching, may have blurred vision, and if it's a lady, might have history of recurrent miscarriages, which many people think is Obanje or Abiku. But many of those people actually had diabetes in pregnancy. And if it's a man, could have erectile dysfunction or impotence. So those are the features of what we call classic diabetes. But more than half of our patients don't have any symptoms.
So it means that I can eat and I put on weight. I don't have it.
You're not likely to have it.
But I hear that somebody, if you pee on a spot and it foams, that's diabetes.
Or ants gather.
That is one that is more characteristic.
Okay.
Foaming of the urine can occur if you're having protein in the urine.
Okay.
And a person with diabetes can have protein in the urine either from an infection or from kidney damage. But the one of ants gathering around the urine, that is one of the classical symptoms. Some people also taste their urine and they say, well, the urine was so frequent, I decided to taste a little bit, and it tasted like honey. In fact, in the olden days, the way to diagnose diabetes was to arrange, if you had 10 patients, all of them will bring their urine, and the doctor had the misfortune of having to test all the urine.
They can taste their own themselves.
Now, so let me connect it a bit to COVID-19.
Wouldn't the doctor catch it?
No, you can't.
Let me connect a bit to COVID-19 because we've been told that diabetes is one of those conditions, as you have underlying conditions, that can actually make you the fatality point of COVID-19.
Make you go over the top.
Yeah, so how, if you're diabetic, how do you protect yourself from getting COVID-19?
Well, if you have diabetes, the way to prevent COVID-19 is still the same for the whole population,
Right.
which means physical distancing, wearing of masks, washing your hands frequently. But the problem with diabetes is that if a person has diabetes and is very well controlled, meaning is taking his medications, blood sugars are brought to within normal based on the medicines and the lifestyle change, such a person doesn't have a much higher risk than the ordinary non-diabetic person. The people that come down with the mortality of COVID are those who have diabetes that is poorly controlled. Because some people have diabetes, they can't afford the treatment or they don't want the treatment.
Why are they more at risk if they have it? What happens with the diabetic patient? Because COVID-19 is the lungs.
Yes.
So diabetes is the blood, the stomach, the insulin.
Excellent question. What happens is that when you have diabetes, the immunity of the person is generally reduced. So a person with diabetes that is not well controlled is at a higher risk of tuberculosis, is at a higher risk of COVID-19, is at a higher risk of sore throat, common cold. Anything has a higher risk when it comes to infections. And that is why people with diabetes, if they have a sore on the leg, it doesn't go. And some of them, it starts to fungate and smell until they remove that leg. Most people will have a sore on the leg, and in the olden days, you see people, they will put spirit or put engine oil, and the thing will heal. But with diabetes, it's not like that.
Unfortunately, we have to wrap up, but no more questions at this point. But I'd like you to very quickly respond to that caller who lives in Badagry and said that there's no COVID. It's important for us to at least speak to people like that categorically. Please, I'd like you to look into that camera and talk to him.
And there's a tweet again that's saying COVID is a hoax. The government played us, destroy 2020 for us, want to control our lives. This is the Andrew. So please answer this.
Yes. People. So for Andrew, the other one, was it Samuel too?
I think it's Michael.
Michael, yes. COVID-19 is not a hoax. There is COVID-19. I have seen them. I have treated them. If you go to most of the hospitals, whether federal or states, you will see wards that are dedicated to COVID-19. The positive point you do have, though, is that sometimes the hype for the condition is much more than how common it is. For instance, COVID-19 is not as common as diabetes. It's not as common as malaria. But you see that it takes a lot of attention. So there is COVID-19.
On that note, we have to end the show. Thank you very much, sir, for joining us. It's a pleasure having you.
Thank you, sir.
Thank you.
Hope you've learned a few things as we have. Have a fabulous day. We'll see you tomorrow. Bye for now.